we have to address our healthcare crisis, and meaning that it's a complicated system, high costs, our health outcomes in our country aren't good enough, and not everyone has access to basic health insurance. And we need to remember that was something that was so awful and still is so awful during this pandemic. We have to fix that. We have to address health equity and the differences in health equity between communities in our country. And we have to strengthen our public health system to help connect all that. So those are some of the things I think we have to do. What I would like to see is us to embrace public health. And I would love nothing more for every person everywhere to understand what public health is, what it does, and why it's important, so that we appreciate that in our country. And that people also know what they can do to keep themselves and their families healthy. And if they are having challenges, who do they talk to? Who do they connect to, whether that's healthcare or a health department? How do they address that? And I'd say the final thing is that I think in terms of, we sometimes cycle in terms of public health needs. And I think we're at a period where we have huge social needs in our country. And that we have things such as housing and food security, um, unemployment, literacy, basic education that really serve as huge impediments to people being healthy. And so I think that may be a national dialogue along with our health equity conversations and addressing racism. But those are the things I'd really like to see us do.